Welcome to the very first edition of Network Africa in the year 2015, and congratulations for making it to another year. It's a new year with new possibilities, and the likes of Liberia are doing what they can to not only stop the spread of the Ebola virus disease, but also to limit the adverse effects of the killer virus. In order to do this, community health workers in Monrovia are conducting door-to-door campaigns to help raise awareness about Ebola among the urban poor. Visiting families, the health workers check on children who may also be suffering from malnutrition.
The threat of Ebola infection also means the healthcare workers must assess malnutrition without touching the baby or mother. Residents here say the spread of Ebola has affected their ability to make a living, which means they are unable to feed their families.
The World Food Program welcomed today a $1 million grant from the African Development Bank to their work in Sierra Leone. With this grant, WFP will provide food assistance for 2 months to 30,000 people. Today, food production in Sierra Leone from 2014 is estimated to be 5% lower than in 2013, and rice production is expected to dip as much as 17% in the Kailahun area, which is one of the country's most productive agricultural areas, but has been severely impacted by Ebola.
Food prices have soared due to panic buying, food shortages, and price hikes.
We have realized in the western area in particular that we are having a high increase of new infection cases of Ebola compared to the rest of the country.
In the West Point area, Josephine, a young mother whose daughter was diagnosed with acute malnutrition, says her husband lost his job during a quarantine period and they didn't have enough money to take the baby to a clinic.
I saw the child was very dry. You come out of the raised bones, you come out of the baboons. The child brought all rumper. And at the child, back of the child, you found tail to the butt. So I said, well, you must say, yeah, or they think I'm like Ebola. So I said, no, man, there is not Ebola, there is malnourished. Then she said, but I said, but why you can't get the child to the other? I said, but where are you getting money from? The Ebola been there, we don't have anything. My husband is not working. Myself, because the Ebola been there, we don't say anything again.
Liberia has succeeded in lowering infection rates, and the virus is now spreading faster in Sierra Leone. 21 cases were reported in the week to December the 21st.
We must all be vigilant until there are no cases in Liberia or West Africa. The mission is taking all necessary measures to mitigate any possible further transmission, both within the mission and beyond. In line with the World Health Organization protocols, the UNMIL medical team is conducting robust contact tracing to ensure that all people who came into contact with a staff member while symptomatic are assessed and properly quarantined.
The world's worst Ebola epidemic has endangered harvest and sent food prices soaring in West Africa. The UN Food and Agriculture Organization, FAO, has warned that the problem would intensify in coming months, increasing chances of issues like hunger and malnutrition. For Josephine's daughter, help arrived just in time.
No, from the time she was not already, from the time we started going to the feeding center, she already now, I can't laugh. You can play by ourselves now. You can be saying about first and she needs to say now, she needs to play.
Ebola was first detected in the southeastern forest region of Guinea early this year before spreading to neighbors Liberia and Sierra Leone.
Still talking Ebola, Sierra Leone is making similar moves like Liberia to control the spread of the virus. Sierra Leone has begun to use new environmentally friendly sterilizing equipment to get rid of the vast amounts of contaminated protective equipment and infectious waste generated in treating Ebola patients. Both countries have been badly hit by the virus.
The sterilizing machine, known as autoclave, decontaminates used medical equipment and waste such as syringes, personal protective suits and gloves through several cycles of high-pressure steam and vacuuming, allowing for their safe disposal.
We've been having problem with our waste, especially in terms of the infectious waste that we have here, because all of the waste that are being generated here are infectious waste, and it's very difficult for us to handle that one. But now that we have got this autoclave, it will be very much easier for us.
It is the first of its kind in any of the Ebola-affected countries, and is now functioning at the Ebola treatment units at Police Training School Treatment Center 2 in Hastings. Autoclaves present an alternative to burning waste in open pits, barrels or inexpensive incinerators without air pollution control equipment, which produce dangerous fumes and expose workers to flames. With autoclaves, medical waste is processed in safe barrels designed to minimize contact and comes out as a dry and sterile plastic mass less than half the initial volume. The equipment requires electricity and water for the internal steam generator and a small drain for releasing sterilized liquids and steam. The autoclave was designed under a UNDP JEF project and is manufactured by a South African company, Mediclave, to prevent the spread of HIV/AIDS, hepatitis B and C, tuberculosis and other diseases that can be transmitted through infectious waste. The United Nations Development Programme, UNDP, is working to roll out the technology to 11 treatment centers across Sierra Leone and plans to send some units to Guinea and Liberia, the other 2 affected countries. The initiative, worth $4 million, is partially cost-shared by the government of South Korea.
This will not only be a contribution, we feel, to the Ebola crisis, but even after the Ebola crisis, this will be an opportunity to reduce, hopefully even eliminate the transmission of things like AIDS and hepatitis and other types of diseases that can be transmitted because of infectious waste that's improperly treated.
Still in a bid to check the spread of the virus, Sierra Leoneans observed a sober Christmas in their homes on Thursday, December the 25th, after the government banned traditionally boisterous holiday celebrations to prevent the spread of deadly Ebola in the worst-hit country. Small groups of Christians were permitted to attend church services, but the family gatherings, beach parties, concerts and dancing that usually accompanies the holiday were banned to help slow the deadly virus.
We should be law-abiding people. As Christians, I believe that we must put into practice what the government has deemed expedient that will help to curb or slow down the rate of this Ebola transmission. So I believe that after the celebration, people should go home and stay with their families, stay indoors, according to what we've heard from what the government said we should do to effect the slowdown of this Ebola virus.
Sierra Leoneans have a reputation for partying in the face of hardship, and bars were often heathen during successive rebel incursions into the capital during more than a decade of civil war that ended in 2002. In one neighborhood, residents seemed resigned to this year's low-key holiday.
The president said we shouldn't go out. We just have to sit at home and do it at home. It's an indoors Christmas, so we are doing it, and I really like it. I really love to be indoors and do my Christmas.
Now, Lord, say nobody don't go to the beach. Everybody for stay at home, then we'd enjoy ourselves quietly.
The beach, usually packed at this time of the year, remained abandoned with police patrolling the shore. Several people were arrested for suspectedly trying to defy holiday restrictions. Police had received instructions to break up gatherings and arrest the organizers. Sierra Leone's northern district of Port Loko, the area with the highest rate of Ebola transmission, planned a 3-day lockdown over Christmas. The rate of infection is fastest in the capital, Freetown, and the neighboring province of Port Loko, where 44 out of the total 58 new cases were reported on Christmas Eve.
Being that today is Christmas, it's just one of those days that people think Christmas should be spent at the beach. So if we allow people to come just cluster, it's not going to help. So it's good that they've come together. As you can see, they're doing real good, yeah? It's fine.
Sierra Leone, neighboring Guinea and Liberia are at the heart of the world's worst recorded outbreak of Ebola. Rates of infection are rising fastest in Sierra Leone, which now accounts for more than half of the over 18,500 confirmed cases of the virus.